Hello and good day, it's me, Carla. I'm a medical student, and for today's video, I am going to perform the female urinary catheterization. So what is urinary catheterization? So urinary catheterization is a process in which the catheter is inserted into the bladder to collect or drain the urine. So before we start, we make sure to check the physician's order, and next is we're going to gather all the things that are needed. So I have here the soap, the washcloth, and the water. Also, I have here the sodium chloride, the cotton balls, iodine, forceps, so let's assume that it's a picking forceps, a 10 cc syringe, a two-way Foley catheter, an underpad, a fenestrated drape, and of course, the gloves and the drainage bag. Also, we need to verify the client's identity, explain the procedure to them, and provides the client's privacy. Also, don't forget to do the hand hygiene. Hello, ma'am. Good morning. I am Carla, your student nurse. And ma'am, kindly state your name and your birthday.
Hi, I'm Rianda Kai, and my birthday is December 18, 2001.
Okay, thank you, ma'am. Ma'am, I understand that you are having difficulty urinating. So the doctors order me to insert the catheter. So the procedure that I am going to do is that insert the tube on your urethra and connect it to your bladder so you can excrete your urine. So is it okay with you, ma'am?
Yes.
Okay, thank you. So now we are going to position our patient in a dorsal recumbent position with the knees flexed and feet flat on the bed. After positioning the patient, perform hand hygiene and put a clean gloves before cleaning the patient's perineal area with soap and water. And now we're going to cleanse our patient with a clean water and mild soap. And we're going to wipe from top to bottom, and in the middle one. Then we're going to rinse off with a clean water, top to bottom, and in the middle part. So after cleansing the perineal area, we need to remove the gloves and perform the hand hygiene. So during the insertion, we need to open the catheterization kit. Then we need to put our sterile gloves, and we're going to drape the patient. Now we're going to pick up the underpad, then ask the patient to raise her hips rather. Ma'am, kindly raise your hips a little bit. I'm going to put the underpad. And pick the fenestrated drape and place over the perineum with a hole over the labia. Okay, ma'am, I'm gonna put this one. Then prepare the antiseptic solution using iodine and cotton balls with betadine. So here it is, the cotton balls with iodine. Then we're going to attach the saline filled with syringe to the side port of the catheter and inflate the balloon. So here is the syringe filled with the saline solution. So we're going to remove. Okay, so as you can see, the balloon inflate. And we're going to deflate it. Put the lubricant on the tip of the catheter. Then apply a sterile lubricant to the first 2.5 to 5 cm, 1 to 2 inch of the catheter tip. So attach the catheter to the drainage system and ensure that the drainage bag emptying port is clamped. So we're going to attach the drainage bag into the catheter. So here is it. Then, being the kit of the sterile field between the patient's legs, then we need to proceed in urethral meiosis preparation with non-dominant hand identifying meiosis by retracting the labia. Hold this position throughout this procedure. Next, with sterile dominant hand, clean the meatus with the antiseptic solution, moving from top to bottom. Allow the antiseptic to dry. So here is my antiseptic solution. So I'm going to wipe the perineal area from top to bottom. So we're going to start from top to bottom, then dispose, top to bottom, then dispose, and in the middle part, dispose. Then in catheter insertion, you need to ask the patient to bear down with sterile dominant hand, slowly insert the catheter into the urethra until urine flows. Then advance the catheter 1 to 2 inch more, so do not force the catheter through the urethra. While inserting, ask the patient to take slow, deep breath until the initial discomfort has passed. Okay, so ma'am, kindly take a deep breath. I'm going to insert the catheter. And then we're going to inflate. And done. Next is hold the catheter with the non-dominant hand. Use the sterile dominant hand to fully inflate the catheter balloon. And then remove the syringe. So I'm done already. Then, after gently pull the catheter until resistance is felt. Then secure the catheter on the patient's inner thigh with a securement device. So we're going to use a plaster. Ensure that the tubing is not kinked and secure the drainage bag on the bed. So after the procedure, you need to dispose the used supplies and place the syringe into the sharp container. Then we're going to remove our gloves and perform hand hygiene. Okay, so now we are going to put our patient in a comfortable position. So ma'am, I'm going to put you a blanket. Okay, so ma'am, do you feel comfortable right now? Okay, thank you. Next is documenting the type and the size of the catheter and balloon, amount of the fluid inserted in the balloon, patient's reaction to the procedures, amount of characteristic of urine, name of person performing the insertion, and the time and date it was completed. Okay, thank you. That would be all. Thank you.